Good afternoon, everyone. Myself, Madhu Kushwaha, Assistant Professor in SIRT Pharmacy. Today, we will discuss about plasma volume expander. Blood is a fluid connective tissue that circulates continuously around the body. Plasma is a clear, sphere-colored watery fluid in which several different types of blood cells are suspended. Plasma is blood devoid of blood cells. Serum is plasma without without clotting factors. Body fluid compartment. There are different type of body fluid compartment. Total body weight 60% of body weight 42 liter. ICF is 40% of body weight 28 liter, two-thirds of total body weight. ECF 20% of body weight 14 liter, interstitial fluid 15% of body weight 11 liter, blood plasma is 5% of body weight 3 liter, 75 to 80% ECF is in interstitial fluid, is the compartment of the body fluid. Different type of body compartment is there. And volume expanders. Volume expanders are the intravenous fluid solution that are used to increase or retain the volume of fluid in the circulating blood. Generally, volume expanders are used to replace fluid that are lost due to illness, trauma, or surgery. They do not carry oxygen. This is the plasma volume expanders. Type of volume expanders. There are two main type of volume expanders, crystalloid and colloidals. First is crystalloid. Crystalloid are aqueous solution of mineral salt or other water soluble molecules. Example, normal saline, dextrose, Ringer solution are the crystalloid solution. Is the example of crystalloid volume expander. Colloid. Second is colloids. Colloids are larger insoluble molecules such as dextrin, human albumin, gelatin. Blood itself is a colloid. Colloids are better than crystalloid because the larger molecule of colloids are retained more easily in the intravascular space and increase osmotic pressure, so more effective resuscitation of plasma volume occur by colloids than produced by that of colloids. Third one is duration of action is relatively longer than crystalloids. Ideal properties of plasma volume expanders. First is isotonic with plasma. Second is distributed to intravascular compartment only. Third is pharmacodynamically inert. Fourth is non-pyrogenic, non-allergic, and non-antigenic. Fifth one is no interference with blood group or cross matching. Sixth is last one is stable, easy, sterilizable, and cheap. Ideal properties of plasma volume expanders. Isotonic plasma volume expanders. This is the ideal properties. Colloidal plasma expanders. First one is examples of colloidal plasma expander is plasma albumin, dextrin, degraded gelatin polymer, polygelatin, hydroxyethyl starch, heta starch, HES, polyvinyl pyrrolidone, PVP. First is human albumin. It is obtained from pooled human plasma, Winchon wrench on development of a method to isolate albumin in a safe and stable form from human plasma. It can be used without regard to patient's blood group and does not interfere with coagulation. It is free of risk of transmission of hepatitis because the preparation heat treated still first line human albumin. Second, dextrins are a group of branched polysaccharides derived from sucrose, beetroot, by the action of the bacterium Leuconostoc, Leuconostoc mesenteroids. Different dextrin preparations are polydispersed mixtures grouped on the basis of their average molecular weight, which is different from the average molecular weight of the mm, prac- practicals with colloid oncotic power, which is important for their homodynamic action. Main type are dextrin 40 available, such as 10% solution, and dextrin 60 and 70 prepared as a 6% solution. Molecular weight is the chief determinant of the pharmacodynamics. Dextrin 70 is the most common used preparation. Second, it expands plasma volume for nearly 24 hours, excreted slowly by glomerular filtration as well as oxidized in body over week, and some amount is deposited in reticuloendothelial cells. Dextrin 40, it acts more rapidly then dextrose 70, it reduces blood viscosity. Third is it is excreted through renal tubules and occasionally may produce acute renal failure. The total dose should not exceed 20 ml per kg in 24 hours. Dextrin can be stored for 10 years and are cheap, so are the most commonly used plasma expander. Cautions: dextrin doesn't provide necessary electrolytes and can cause hyponatremia or other electrolyte disturbances. Degraded gelatin polymer, polygelatin. It is synthetic polymer polypeptide of molecular weight 30,000. It doesn't interfere with blood group and cross matching and non-antigenic expand expands plasma volume for 24 hours. It is more expensive than dextrin and can also be used for the priming of heart, lung, and dialysis machine. Brands: Hemacell, Seracell 50 ml vaccine. Hydroxyethyl starch, HETA starch is also called. It is a complex mixture of ethoxylated amylopectin of various molecular size. Average molecular weight is 4.5 lakhs. It maintains blood volume longer. It doesn't cause acute renal failure or coagulation disturbance. Uh, it improves hemodynamic status for 24 hours. Heta starch, adverse effect of heta starch: vomiting, mild fever, itching, chills, flu-like symptoms, swelling of salivary gland, urticaria, bronchospasm, etc. Brand: Expand 6% injection, 100 and 500 ml of vaccine. It has also been used to improve harvesting of granulocyte because of acrylate erythrocyte sedimentation. Adverse effect: anaphylactic reactions, mild fever, chilling, preorbital edema. Polyvinyl pyrrolidine (PVP). It is a synthetic polymer of average molecular weight 40,000, used as a 3.5% solution. Polyvinyl pyrrolidine was used as blood plasma expander for trauma victims after the 1950. It interferes with blood grouping and cross matching and is histamine releaser. It binds to penicillin and insulin. It is excreted by kidney and a small amount by liver into bile. A fraction is stored in reticuloendothelial cell for prolonged period. It is less common used plasma expander. Thank you.